who are running 1 or 2 minutes late, a minute to jump on and not miss anything. So I'm Ashley Brooks Russell. I direct the Injury and Violence Prevention Center here at the University of Colorado Anschutz Medical Campus. And we're pleased to welcome you today to our Research to Practice webinar series. But before we get to the talk of today, I just want to announce a couple things. First of all, as you join the meeting, your video and audio should have been defaulted to mute. Please keep it that way until we get to the Q&A portion. This is a Zoom meeting, not a webinar, so you will be able to unmute yourself and come off camera if you have a question that you can ask. But of course, you can put it in the chat at any time, and I'll be the moderator, so I'm able to read that and get your question answered if you'd prefer not to come off video and audio. This recording will be shared, and we can make that available as we do with all our webinars. They're available on our YouTube channel. I also want to highlight the next two seminars that we're going to offer. First of all, the Firearm Injury and Violence Prevention Initiative is hosting a webinar on October 8th at 12 p.m. Mountain Time. It's titled Co-Developing Theories of Change for Improved Community Violence Intervention Evaluation. That will feature a panel of 4 speakers. So mark your calendars for that. And if you get either the Firearm newsletter or the Injury Center newsletter, that will be announced in there. You can find out more on our website as well. And then October 16th, we're going to be hosting a hybrid seminar. So it'll be both Zoom and in person, featuring a new associate professor on our campus, Dr. Rochelle Leone. And it's titled Understanding and Preventing Alcohol-Related Sexual Violence. So please join us, particularly in person for that. It's 10 a.m. October 16th in the Anschutz Health Science Building, and we will be providing coffee and refreshments. So if you're trying to decide if you should join online or in person, I'm going to strongly recommend in person for that. All right, with no further ado, let me introduce our speakers today. I want to express some gratitude for video conferencing, that it allows us to feature our colleagues from so far away from across the country. Today we have Doctors Terry Powell and Bianca Smith-Black from Johns Hopkins Bloomberg School of Public Health. And they'll be talking today about preventing youth violence through curfew enforcement, community and youth engaged approach. So with that, let me turn it over to our speakers, and you can, I think, screen share. I mean, your screen is shared, but you can enter presenter mode.
Great. Now. All right. Thank you so much, everybody, for joining. I'm always a little wonky with time. So it's 2 p.m. here. What time is it where you are in Colorado?
12 p.m. So probably.
Okay, noon seminar. Okay.
And Terry, we do see the slides on the left. It's not the full screen view yet. So.
And then I just stopped sharing. Look at that. Okay, let's go back. Here we go. There's that. And then we'll do this. There we go. How about now?
Yep, it looks perfect.
Excellent. Thank you so much, Ashley, for the invitation. So my name is Dr. Terry Powell, and I'm an associate professor at the Johns Hopkins Bloomberg School of Public Health. I am in the Department of Population, Family, and Reproductive Health. And so the work that we're sharing today is the result of a small evaluation that we did with in partnership with the Baltimore City Mayor's Office of Neighborhood Safety and Engagement. So I'd like to allow Bianca to introduce herself.
Sure. Hi, everyone. I'm Bianca Smith-Black. I am a second-year postdoc in the Department of Mental Health at Hopkins. My work really evolves around spatial epidemiology of trauma and mental health among emerging adults. And so I helped do the analysis on this project.
All right. And Bianca and I, we've been working together even before she was a postdoc. So we're like old pros together. So thank you in advance. And so I always like to start my presentations off with an acknowledgement. So you see Bianca and I, but this was like the work of lots of other folks. So just a huge shout out to our partners at MONSE. That's the nickname at MONSE, for inviting us to do this evaluation as an external evaluator, and also just sharing their data and insight as we were going through the process. I'd also like to give a special thanks to the Bloomberg American Health Initiative. They are using funds from the Bloomberg American Health Initiative. We were able to support Bianca and other folks on this project. And then finally, the B Lab. And so that is my team of people. At the end, I have our Instagram and our website and all the things. And so like folks would always like, we'd bring this to our team meetings and we'd always get really good feedback on and directions to go. So many, many thanks to all the folks who were able to support and contribute to this work. So a little bit of background. So for those of you who are unfamiliar with Baltimore, we're, not a huge city. I'm a Chicago girl, so nothing feels as big as Chicago except New York and LA. So we have a little under 600,000 residents, and we are a mostly African-American city with about 58% of our residents identifying as Black or African-American. Our poverty rate is at about 18.5, which is higher than the state, but not necessarily as high as they are in the country. And our crime rate is at about 48% per 1,000 residents, which is also high for our state, and high in general for urban areas in the U.S. And so as we think about the nature of this talk, so youth violence all over the country, similar like in Maryland, it represents a very small portion of all the crime in our state, right? And so, but that doesn't make it any less irrelevant. And really what we know is that young people are more likely to be the victims of violent crimes than the perpetrators of them. And over the past couple of decades, with the exception of the last 2 years, over the last few decades, youth violence has been just declining in general across the country, and in addition in Baltimore. But then over the last 2 years, we've seen some increases. So since COVID, everybody's back outside, all of the things that have happened with COVID, we're back outside, and we've seen increases in crimes in our city, in our state at large. And then there are also an increase of number of youth who are victims of violent crime. So whereas I said before, they're usually, the numbers were declining in every direction, and over the past few years, they've been increasing, including victims and in perpetrations. And then for us, one of the things that is also important is, I mentioned earlier, we're mostly Black city. There's been an overrepresentation of youth of color in the juvenile justice system, right? So both as incarcerated young people and as victims of violent crime. And so our city, we aren't the only people who notice this. Our mayor in 2021, he released this comprehensive violence prevention plan, and it had 4 pillars. So the pillars were a public health approach to violence prevention and intervention, youth justice, pillar 2, which I have listed here, youth justice and youth and violence reduction, community engagement and interagency collaboration, and then finally, evaluation and accountability. And this was it's a 5-year strategy. We're in year 3 of it. So the initial phases were around like building collaborations and understanding what the issues were. And each year, every 2 years, they've released a report and update on this. And so the details of pillar 2 are listed on the slide. And there are 3 major things that they wanted to work on. The first was to adopt proven and community-based solutions to reduce youth arrests. And so not only, yes, in general, up until now, I've talked about violence, but the number of youth that there's enough data to show that any interactions or any interactions with law enforcement can be stressful for young people and have long-term negative effects. And so like if we are able to if we're able to focus more on strategies that de-escalate rather than escalate situations, that may help us reduce youth arrests. The second point was to augment and connect violence intervention and prevention programs for school age youth. And so I am one, and perhaps many of you work in schools. As we know, lots of young people are in schools. And so it really is, and we have an audience that is there and often willing to, and schools are often looking for programs that will support their overall goal of like having a better experience for students in school. And so partnering with schools and having programs so that young people are able to manage their emotions, resolve conflicts in schools. And the hope is that those are also transferred to out of school. So one of a particular program that, a particular approach that's been used in Baltimore City public schools has been the focus on social and emotional learning. And so there is, every month there's self-awareness, social awareness, and all of the areas of social and emotional learning. And rather than penalizing students with out-of-school suspensions or removal, there has been a rise in using restorative practices as a way to resolve conflict among students at the schools. And then the final point of Pillar 2 was to implement interagency level changes to shift long-term youth outcomes, right? So we recognize that youth, like violence, is just one of many things that we may be thinking about for young people. No one wants to have a young person either involved in violence, whether it's as a victim or a perpetrator. But we also want to make sure that young people have stable housing and that they are also living in food secure outcomes. And so that definitely requires us to think across agencies about youth development as a whole, rather than like violence prevention as an individual strategy. And so one strategy that has been lifted up that kind of combines these three pillars is our curfew enforcement, right? And so curfew enforcement is not a new thing, right? And so this has been on our books for a while. And so because of it, again, these last 2 years, the increase in number and seriousness of crimes committed by minors, not only against people, but also property in the city, it creates an opportunity for us to think about like public peace, safety, health, and just the welfare of not only young people, but also like the adults in our city. And so this curfew policy, I have the details there. And so it is essentially a tool to regulate the hours during which minors are in public spaces. Like that's the actual description of it. And in certain establishments without adult supervision. So I don't know, again, what's happening in Colorado, but in our cities for the last few years, even malls have like curfew policies or minor policies. And so this one is consistent across the entire city. And so as you can see, it operates primarily during the summer. And you're like, why during the summer? The expectation is that most people are in school during the school year. And so having the likelihood that there are young people out all the time is lower. And so the resources that would be extended during the school year are saved up during the summer when there are fewer activities and more unstructured time. So from Memorial Day weekend through Labor Day weekend, which doesn't necessarily align with our school year. Our school year, we start before Labor Day and we're in school through June. But again, like those last days of school and first week of school still are included in our curfew policy. And so the rules are different depending on age. So it is the full law is enforced for all minors, so anyone under the age of 18. But for anyone under 14, they have to be home by 9 every night, right? So that makes sense. You're 14 by yourself, you probably shouldn't be hanging out. And then for folks in between 14 and 17, these are our high school students. They differ by weekdays and weeknights, so a little bit later on the weekends. In our city, we've had a history of this being a punitive policy whereby young people were detained. So going back to that point on the last slide about arrests, young people were detained and taken to the police station, and they had to wait there until their parents came. And for repeat offenders, their parents got fines. And so this was not getting us to the goal of supporting families and making the city safe. And so last year, our mayor, along with his staff at Muncie, the Mayor's Office of Neighborhood Safety and Engagement, talk to folks. We're like, how do we do this better? Like if right, like this is what I love about community engaged approaches. It's like, well, we all want the same thing. We want our young people to enjoy the summer, but we also want them to be safe and not engaged in crime. So how do we do this better? And so and they they partner with the University of Maryland and folks at Hopkins to talk to young people, talk to police officers, talk to business leaders, parents, city workers, to think through what they wanted and what it could look like, right? Because young people are like, oh my gosh, I just want to hang out after I've like, maybe worked all day. And business leaders are like, yeah, but we don't want you to scare away our merchants, right? And so it was really important to have as many people at the table as possible. And so one of the approaches that they decided to use was the development of youth connection and engagement centers. So that's the idea. Like we want to connect folks and engage them in pro-social behaviors and deter them from crime, or just keep them busy so that they're not able to participate, rather than penalize them for being out. And so the goals of this approach were to just make sure that youth weren't out after curfew hours. And if they were in a safe place, right? Like there were late night basketball games, like pool days. And so it's like, okay, fine. If you wanted something to do, we can address that issue. But let's like have it in a place where you're safe and there's some monitoring that is happening. And it was also to support parental accountability and ensure that parents have a safe place to pick their young people up, right? So, in a perfect world, we are all off when our children are off. In the imperfect world that we actually live in, that is rarely the case, right? So, I am, and I think that, folks who were shift workers were most negatively impacted by this. If they were working late at night and they had, older children or other adults in their neighborhood watching their kids, like this, we were penalizing parents who were already having a hard time. And so rather than do that, we're like, oh, okay, fine. Let's like make sure that there's a place that they can go if they didn't want to be home, and if they were out, and we would still be able to, we can pick them up. We had vans in 3 locations. We could pick them up and take them either home or to one of our youth connection centers, right? So again, like all about like making sure this is safe, and that parents did not feel like they were attacked if their children weren't in the house on time. And then the third point is sometimes people are out not just because they want to be out, but they have nowhere else to go. And so we saw this idea of having this youth connection centers framework as a way to also identify high-risk youth and provide them with intervention and connections to services, right? So if there was a young person who was out because they didn't have stable housing, or they were having trouble at home for whatever reason this was a way we had social workers to be able to help provide some of those resources to young people. And then finally, of course, to reduce youth involvement in violent crimes and crimes in general, right? And this is on either end, as a victim or a perpetrator. And so the system that was set up in the summer of 2023 was that the city decided to prioritize 3 areas in the city. So our Inner Harbor, a neighborhood called Fells Point, and Federal Hill. So they're closest to our downtown area here in Baltimore. And our volunteers, along with volunteer organizations, along with staff, were at each location. They had a van, and in the van, there was not police officers. There was a social worker, there was a young adult peer mentor, and there was also the person who was driving, so the transport staff. So this group, in each one of those areas, they had a van, and then they had a host of volunteers from other organizations in the city that started the hour before curfew was supposed to take into effect. So everybody was out at about 8 o'clock saying, hey, curfew's coming up, like make your way home. If there were young people allowed, they're like, hey, how old are you? And if they were if they were minor, like, oh, are you waiting or are you with an adult? If not, you should probably head home. Do you need a ride home? Are there other services you need? And so this is what happened throughout the summer, right? So like no one was arrested, but rather it was like, all right, we're just reminding you that curfew is being enforced and we want to make sure you get home safely. So our evaluation and the rest of this presentation will talk about, well, what happened, right? And so first we analyze, our goal was to, well, to be honest, our original goal was to like learn more about what happens at these youth connection centers, but the program was so effective that nobody actually went to the youth connection centers. So instead we analyzed the curfew staff engagement, and we also looked at changes in youth crime by year. So the 2022 year in which the program was enforced, when it was much more BPD or Baltimore Police Department enforced, compared to the summer of 2023, when it was a youth engaged and community engaged approach, where people were not penalized, but rather like supported to either go home or move home, and parents were not penalized. All right, so I'll turn it over to you, Bianca.
Cool. So we use two different approaches to look at the data. So first, yeah, you could go to the, so first we use a qualitative approach. So using content analysis, we coded the communication from staff, and this included text communications and notes from the staff iPads. And so our team came up with 8 categories where each row of data had a max of 3 codes. So this included reported activity, transportation, resources about the curfew program, curfew attitudes from the youth who interacted with the staff, and discussions about any police activity or presence. Next slide. So next we use data from the Baltimore Police Department. So we examined the trends in youth-involved crime during the summers of 2022 and 2023. And here we define youth-involved crime as crimes against youth 18 and under. And just a little bit about the BPD data. So it collects police-reported information on all crimes committed across the city of Baltimore. So it includes information on the race, age, and gender of the victim, the type of crime that was committed, and the location, date, and time of the crime. Next slide. You can go to the next slide. Yeah. So most of the communications came from transportation staff, social workers, and the program staff. And this represented about 18% of the communications that were sent out. And we had over 400 pieces of qualitative data from the staff. So we saw a few peaks during the first and the last week of the summer break and during the holiday weekend. And you'll see later that these peaks coincide with peaks of increases in citywide violence. So, next slide. Okay. So of the 8 original codes, 3 represented the majority of the data. So there was a lot of communication about the environment, and this included the location of the staff and like the vans and information on neighborhood descriptions. We also had a lot of codes describing social activities at the site, and this included like who was around during the stops and when they were talking to the youth. And we also had a lot of check-in messages just regarding the geographic location of the staff. And so most of these are within the program area, but there was also, staff had also traveled to 50 other locations in the city that were outside those 3 areas. And just a note here that police activity was mentioned in fewer than 3% of the codes. So during the summer of 2022 and 2023, there were about 1,300 youth-involved crimes. And as you can see here, there was an increase in 2023 across all of the months here. So most of the activity was happening in July of 2023, and that kind of connects back to that increase in communication that we saw during the holiday weekend. So next slide. So here is the distribution of crime by type. So we pulled the most common types of crimes, which included different types of assaults and robberies, and we still see this trend of more violence occurring in 2023. Next slide. So we also looked at the percent change from 2022 to 2023. And we see here that there was an increase across most months during the summer breaks. But we do see this decrease in assaults during the last week of the program from 2022 to 2023. And so for this analysis, we collapsed the different types of assaults and robberies into these 2 larger categories. and they're listed here of how we like combine them. Next slide. So lastly, we looked at the temporal trends. So again, we see this like increased activity in 2023 across most of these time frames. And if you click the slide, but what stands out here is that most of the crimes were occurring after school hours, so between 2 and 7 p.m. And then in 2023, we also saw this like small upward trend in activity during like that midnight hour from like 10 to midnight. So on to Glory.
I guess it's Glory. Okay, so big picture things, right? Like, so, we didn't see what we wanted to see, right? This is a hard thing, right? Like, and if you continue to do research long enough, this will be a thing you see like, oh my gosh, we did our best science, we had the best ideas, and we didn't see the change. And so like now I want to talk a little bit about how we thought about this and some of the recommendations that we made to our partners. So I have 4 here. The first 2 are really related to staff engagement. So we believe that it was an excellent approach to continue and to have social workers rather than BPD staff support the curfew enforcement. And we told our partners that is a we heard from like young people, we put people at the table, and this is something that was really important, and this should be continued. So the decision to involve the non-BPD staff for curfew enforcement, like I said, responded to what families wanted. And so based on the staff, these staff were actually highly engaged and dedicated to ensuring that youth were safe during the summer. So relying on community partners near peers offered this sense of familiarity and understanding that may be missing from youth interactions with law enforcement. And so again, like if anything, like, hey, let's continue moving that they were there and it was good, and there was very little need. There wasn't a need for police involvement, right? As we mentioned, fewer than 3% of these interactions ever reported police involvement. So the second point is that based on our read of the data that we received from the tablets and iPads, and the digital data, like just staff probably need much more specific training. So the range and type of information that they shared via text and tablets is just wide. As you saw, like sometimes it was like, oh my gosh, it's so nice out here, to there are 50 youth, we need some support, right? Like those are very different types of messages. And it's not clear to us that all of those types of messages are needed or useful. And so more guidance may be needed to ensure that these tools are used to relay the most essential information about the location and interactions. It might also be useful for, we suggested that they have drop-down menus or even pre-selected resources to share with youth. So just to make it easy, like, hey, this is what we did, this is here. So people don't actually have to type, you can just kind of select. And based on what we learned last year, we could very easily create a set of options that cover most of the essential information that we want to capture. And it was hard, although that the protocol that all of the van group were given. The protocol said that at every interaction, they should be giving out resources about like, hey, here's some things that are happening over the summer that you may give. That wasn't always communicated in their text or on their tablets, right? So we weren't able to get a sense of how much information was shared or the reach that the staff may have had, because that was not captured. And it was also not really clear. So although there was very little police involvement, we couldn't quite tell the level of training that staff had to actually de-escalate, right? Like maybe it was just, their presence there, but on those times when the police was there, we were like, oh, what was happening in this situation that made this different and required a police presence versus others, right? And so, but the only thing we could tell was like maybe numbers, like, oh, it's just more people, and the curfew staff was like, whoa, this is too much. We can't quite figure it out, or there's just too many, right? And so we think that if with some additional training, the staff can better communicate what is happening on the ground so that in future evaluations, we'll be able to continue to tinker with this approach to improve it. And so the last two recommendations that we have are specifically around preventing youth violence, right? So the first two were like, how do we like make sure the staff is well trained and able to communicate? And these last two are really about preventing youth violence. So consistent with previous research around peak times for juvenile delinquency, we also found peaks in youth involved crime from about 3 to 6, right? And so this isn't even when the curfew program is operating. So like, this aligns with, they're not in school, but it aligns in our city. We have a summer youth works program that ends at 2, right? So like it ends at 2 and people are out, right? So like they're out and there may be fewer structured opportunities. And so one of the things that we recommended is like, maybe we just need more structured opportunities in the afternoons for youth to participate in, which would decrease the likelihood that they're involved in crime, either as perpetrators or as victims, right? And so, and high quality programs during these hours could foster pro-social learning and pro-social behavior. They can learn a skill, they can make money, all kinds of things, right? And so such programs can also offer like, a way for them to be able to meet others and get to know each other, because again, in our city, a lot of times conflict is just because like people are like, oh, I don't know you, or I think I know you, and you may have said something about somebody, like it's second or third hand. And so if we have these structured opportunities and ways for young people to get to know each other, we may be able to, again, reduce some of just the conflict that occurs in general. So we recommended that the future approaches to the summer youth engagement and safety might consider offering additional structured opportunities during these down hours during the day, or even down hours during the summer. And so like we saw, yes, at the times of day, but then also at the times of the summer. And so these options, of course, should be free or low cost to ensure access for all families, and should be also offered all summer and not just from 4 to 6 weeks. Even I, as a parent, I have a 16 and a 6-year-old. Those 2 weeks, I'm stressed between the 2 weeks in which school ends and summer programming starts. Like, it's like, all right, where are the kids? Where am I? Who can watch them? What activities can they get in? And often those options, those high quality options are very expensive. And if you have multiple children, it's just like, it's not accessible to you as a family. And so the final recommendation that we made was that we, of course, believe that all day support is needed to curb youth violence. So this, again, enforcing curfew alone won't get us there, but the city leadership may consider having like an ancillary program in the afternoons to, and this kind of program could, yes, it could be the actual program, but it could also just be like a navigation so families can identify some of the learning opportunities or earning opportunities for young people. And again, reducing like the likelihood of young people being involved in crime. And since there's already like widespread support from community-based organizations and staff, they might be also really important and vital to connecting families to these services outside of the curfew enforcement hours. So for example, a social worker may be more easily to make a warm handoff at 2 p.m. than they could at 10 p.m., right? And so just the idea of having these resources available to families before the evening hours is a real place of improvement for us. And so I just wanted to share 2 final thoughts before we started our discussion, right? And so, as I mentioned before, when we talked about when I discussed the comprehensive prevention plan, we have to think about preventing violence in the context of other social determinants of health. So what other issues do we need to be addressing besides violence? Is it housing? Is it lack of access to healthcare, or is it like transportation? What are these? Are there like learning things? Like, what are these other things that may be happening that violence just may be one symptom of, but not necessarily the root cause of it. So we really need to be thinking more, not violence as a part of as a whole child and a whole community rather than itself. And then also who needs to be involved. Like I said, this approach, this community and youth-driven approach, people were at the table. Like we had young people from all over the city, community-based organizations, and not only were they at the table, they were willing to be like put their money where their mouths were, right? They were out at nights trying to make sure youth are safe and at home. If you remember from our earlier slide, there were messages sent from our engagement staff like at midnight. So these are people who also may have families, but they're willing to be outside at midnight on a Saturday night, making sure other kids are able to get home. And then how do we improve communication and collaboration? Like any big organization, cities are big organizations. And so figuring out who needs to know and when do they need to know and how do we navigate their systems? Like those are real things that we need to figure out if we really want to be thinking about, again, the social determinants and all of the ways in which these issues intersect. And then the second major point that I was thinking about as we concluded this evaluation was like, I think it really is important to invest in good ideas, but the outcomes may take time. For any of you who've ever been on a grant, right? Like 5 years never seems like enough. Like 2 years doesn't seem like enough. It takes time. Like we are trying to turn a cruise ship, and maybe we didn't see the changes this first summer, but that doesn't mean that the approach is bad. And that really was the message that we shared with our partners after when we were presenting the evaluation findings. Like, it's not a bad approach. Like there is nothing but good to think about, like bringing people to the table, listening to what was happening, what the desires were, and thinking about it. And so I think that I'm glad to say that even this summer, the youth and community engaged approach was used again. And then I think that, for funders and for people who are victims of crimes, where they're young people or adults, they're like, well, how much time? Like, how much time do we need to see the changes? And are there other benchmarks? So like, if violence isn't going down, like are kids being more engaged? Are they happening at different times? Are like, what is it? How long do we need to wait to see change before we change courses again, right? And so those are my last two thoughts, and we've left about 20 minutes for folks to discuss. I'm gonna just minimize my screen. Yeah, I'll do that.
Thank
And
you
open
so
it up
much.
for discussion.
Yeah, thank you, Doctors Powell and Dr. Bianca Smith-Black. I'm going to just give people a moment to collect their thoughts and what questions they have. And I do encourage you to come off mute to ask that. I got a question in the chat kind of about the broader topic. So maybe a bit of a tangent here about trainings for police de-escalation, and what that's happening maybe locally or nationally in that space is kind of this broader kind of paradigm shift as it relates to police response.
Yeah, as some of you may know, our city is under a consent decree, which is like a federal mandate from the Justice Department about like the disparities in treatment and residents by the police department here. And so part of that is additional training for police. And this is happening in a couple of ways. One, we have a mandate now in our city. We call it the Elijah Cummings Act. But it's essentially that our city organizations all are mandated to go through some kind of trauma-informed training. And so I think that may be one step in the right direction. I think another step in the right direction is just like, like a challenge has been just like increased turnover in our leadership around the police department. But now that, like there are ways I'm trying to choose my words carefully. Additional police officers are being hired. And the model of training for new recruits does include this trauma-informed training. And I think that what will need to happen over time is like, how do we now, and again, I don't think that the police department is unique to this. It's any system. It's even Hopkins is a system. How do we now shift the culture of those who've been in the system and it's worked for them? And so those are things that we're trying to do, right? Like, I think that there is an increased scrutiny when something happens or when something is reported by a resident in the city, and a process for that to happen. And honestly, I don't know if we're getting far enough and quick enough for residents to be able to feel that there's difference and that people are really invested in making sure the residents feel safe and not fearful of the police. And so I think that those types of trainings being offered right off the bat for new recruits is a step in the positive direction. I think we are still working on challenges with existing officers and the extent to which they're using excessive force, especially, mostly on African American people in our city.
And you minimize Zoom, but you can actually end sharing.
Oh, yes.
And I do have another question, but I'm gonna wait for someone else to ask. It's so hard for me to not fill space, so I'm just gonna count to 5. All right. That's something I try to practice in class too.
Me
just
too.
So I really appreciate your discussing sort of the findings that you had, that there's this good idea, it makes sense, everything points to it working, and then maybe the data don't come out exactly as you expect. This happens all the time to us, and and it's hard. So I appreciate you sharing that. And I'm just curious, sort of, maybe as academics, we've run into this before, we've been disappointed before, but how your partners responded, or, perhaps the data to them, they had other kind of indicators they were looking at, so maybe it had different value, but sort of how your partners reacted as you shared your findings with them, and how it's affected the collaboration going forward and the plans for the next year.
They did. And so their primary marker was homicides. And we did not include that in the report because that was that was one of the lowest data points ever. But that is a point that they were very interested in. And so over the 2 years, and it's tricky, right? Like, so this is something we went back and forth with their epidemiologists. Like, so the numbers that we see and like the way that it is interpreted was a little bit different, and we didn't understand it as well. And so we thought that there was an increase in homicides, but after discussions, they're like, no, there wasn't. Because what happens in the police database is that a shooting can happen in February, but if the person doesn't die until July, it's considered a homicide in July, but really it was a homicide in February. And so if you kind of take out all the people who were not actually shot and had a fatal shooting in the summer months from May to August, there was like an 80-something% reduction. So it went from like 8 to like 3, right, over the summer. That is great. Unfortunately for us, we're like, yeah, but that's like the lowest data point. And so it is the part of the reason that we display the robberies and aggravated assault is because like this is the burden of youth crime on the city. So yes, while like those 4 families are like, oh my gosh, we'll never be able to replace, like over and over families in Baltimore are experiencing someone, with like assaulting them or robbing them at gunpoint. And even if we wanted to go to shootings, there was an increase in shootings. And so as we were having this conversation, they too were like, wait a minute, but a couple of things happened. One, there was a reduction in homicides, and that is a good thing. And there was a reduction there were no huge like downtown like fights. Like we had these like really big fights and where people were like shot and stabbed like a couple of summers in a row in those 3 areas that I'm in the kind of city center. And they're like, none of that occurred in 2023, and that was a success. And so, yes, we're like, yeah, but like, if we're really thinking about the city, how do we kind of like mesh these 2 things, right? Like, how do we share with residents in a way that tells a full story that's not like, oh my gosh, like wave the white flag, we won it, but rather there is like, we're moving in the right direction and there's work to do. And so they were receptive to this idea, like, thank you for at least saying, like, we shouldn't just 86 this, right? Like, we shouldn't like kill this idea, right? Like, we spent so much time investing in a different approach where the police weren't involved. Thank you for also believing that it could work with some tweaks. And so it continued this year. We didn't get the staff data, so we were not able to include it. Like, we like looked at the like crime data, we're like, oh, it's not the same if we don't have like all of the same sets of data for both summers. And so I think that like that was hard, right? Like, I don't think everybody, but I mean, again, I applaud their bravery for allowing like external evaluators to come and say, hey, here's what it really looks like, and here's some of the ways we might be able to think about this moving forward. So, so yeah, like this summer they had a lot more youth engagement opportunities, which was suggested, right? And I think, again, part of the thing that we were recommending is just more, but more comes with a price tag, right? So like, it's easy for us to say, oh my gosh, we need more at this time, we need more, like across the day, across the summer, with a finite budget. And so I think that they're also wrestling with that, hearing the need for more, for families to be able to have like, care during those, like what I call down weeks between when school ends and programming starts, or have care right after school when kids are out of school, but parents are also still at work. And so again, that requires money. And I think that right now, like, we're starting trying to figure out like what's possible given the finite resources that we have.
Yeah, funding definitely popped into my mind as you talked about that recommendation of filling the gaps in programming. And I can imagine city budgets for,
Yes.
youth activities are just stretched thin
Yeah.
as it is. So there has to be political will there certainly to raise that
Mm-hmm.
money.
Mm-hmm.
All right, I see there's a question in the Q&A. Have you looked at youth violence trends more broadly across the state or nation for the same time period to see if there's an increase overall around youth violence? Curious if this is more of a global trend. I'm also wondering if there are any measures you can access around youth or community feelings of safety, and if those are increasing with this efforts. Thank you.
Okay. So I'm going to answer the first part first. No, but that's a great idea. Like, Bianca, we might need to go back to like bring all your geospatial, your spatial stuff together. We've not, and it's far enough in the past that all the data probably exists now. So we haven't, but that's a great idea. So stay tuned on that. It could have been, right? And so I do think that trends across the country were increasing over the past 2 years. So I'd put my educated guess would be that it is similar. I think I'd be interested in like the time thing, that like, so like when it's happening and what's happening, right? So we did not, we saw an increase across the board in violence, but maybe there's some places where, all right, there are increases in assaults, but not shootings, or shootings, but not robberies. And so I think that those are types of things that I'd also be interested in, like, what if crime isn't created equally, what crime is being, what's increasing, and how are youth involved? And then the second question is not yet. And so the city, a different group in the city, is like exactly what you said, like, man, like, how are residents feeling? Like, we're doing all of this, like, what's the sense of the residents on their safety, and young people too. So this doesn't just limit itself to the adult residents. And so folks here at Hopkins, they've been collecting data for the last couple of years, as a part of their 21st Centuries project, like asking about safety and transportation and all of these other things. And so, but that's still like not big enough. And so another part, like a nonprofit that spun off from the Elijah Cummings Healing Cities Act. So is the Healing Cities Baltimore, and I'll drop their link in the chat before I leave. They're also trying to like evaluate these efforts, right? Like, are people feeling safer? Are they feeling more comfortable with their neighbors, with young people? Or are we all still at this kind of heightened sense of like, watch your back? You got to watch your back. You got to watch where you're going. Anytime in this city, anywhere is like an opportunity for something bad to happen. And so not yet, but that data should be coming in in the next couple of years. And my hope is that these efforts will continue, right? Like we'll continue to make tweaks to this approach, still like working with businesses and young people and social workers and folks across and research to think about what levers do we need to push to see this have an impact. That was a great question though. And like especially thinking about what it looks like compared to the country. Maybe we do like a propensity something. Let's talk about that, Bianca. That's good. That was a good idea. That's a great idea. So thank you.
And can I add to the spatial part? So we did look at the spatial distribution because the BPD data can be geocoded. So we did see that like the 3 program areas that they picked, like it was a cluster. But if I recall, there were 2 other clusters like across the city. So we did a quick look at it.
Yep. Thank you for reminding me of that, Bianca. And that was one of the things we also mentioned too. Again, the more, like it's always more will do it, right? And so we prioritize 3 areas, but as we mentioned before, people like the vans were in like 50 different, like they talked in their like notes about being in 50 different areas across the city, and 3 vans are just not enough, right? Like, and I'm not saying we're a huge city, but it's pretty big, like big enough. And so like if I'm in one area and it's like 10 miles away from another area, like just increasing the capacity of these groups to be able to usher people in after hours across the city that's kind of spread out. It will be important moving forward. What other questions do folks have? May I ask a question, Ashley?
Yes, and then there is one in the Q&A, so I think.
Okay, well they can go and then I'll go because I want to make sure we get their question.
So the framing of the study seems to be curfew with police or without. What would you say is the example of cities like Newark, which has cut its murder rate in half without youth curfews? What's the data on the efficacy of your youth curfews in general?
Yeah, that is good. That might be something we need to go into. I think that based on our kind of like read of this, it might not be the curfew. Like this won't be it. It could be a part of a puzzle, but again, like if these aren't the hours where most youth violence is occurring, then we need to be thinking of other strategies. So I think that yes, we will need to continue to think about other strategies to help youth. But I think that the curfew has stayed on the plate in part because remember, we have everybody at the table and merchants are at the table and they're like, but we don't want people to be scared to come to our businesses. And so part of the way that the city has been responding is like, okay, maybe if we're saying like, hey, we have this approach to make sure young people aren't congregating or aren't, or if they are, they're with an adult. So like, there's no reason to assume that because a young person is there, that they're going to cause trouble. This will make everyone like visitors, residents, merchants more comfortable being out at night. So yeah, I want to go downtown and like, go to XYZ restaurant. I don't know if I want to go because last week I heard that somebody got shot. Well, if you're not hearing that, your chances of going and then like kind of stimulating the economy in Baltimore may raise. And so I think that is part of the reason that the curfew enforcement remains on our list as a strategy and to address pillar 2 and the violence prevention.
There's one more question in the chat. What are your opinions on gun violence in relation to this topic and in the city and neighborhood? So
gun violence.
Yeah.
Yeah, I mean, so we didn't present this data. Again, this was a lower incidence, as I mentioned, like, violence is a small part of all violence in Maryland. So we are no stranger. There were an increase in shootings in our city, something like, oh my goodness, like, let me look at the slide. by 54%. So in the summer of 2022 was 28 shootings, and then in summer 2023 there were 43. Yeah, I think that, yeah, trying to figure out like how to make sure people are, let me back up. I think that Maryland has some of the most restrictive gun laws on the book. Like they require training, they require courses, and like you have to go through several steps, more steps for conceal and carry license. So like I think that there are lots of laws on the books. I think that what is happening is that if people are able to circumvent these in illegal forms, and like young people are being able, young people have access to them as well. It's just harder to see the impact of those like laws. And I think that that is true in our city. There were several reports a couple of years ago about the ghost guns, and I was just like, what is happening? And the increase in access and guns just on the streets. And so I think that, we need to think about how are we responsible with our gun legislations. But also just to really think about, like I was saying earlier, like I don't think it's just the guns, right? Like people kill people. So I'm thinking about what else are people struggling with that we might be able to intervene on, in addition to having responsible gun legislation. How are we also making sure people have enough to eat, or that they are like they have somewhere to go at night, or that they are free from violence in their homes, and abuse in their homes, and can get the access to mental health and physical health care that they need, because all of those things also contribute to our to violence in this country, gun violence or otherwise. And so I think that, again, violence is a part of a much larger system. And so it'll be really important for us to continue to work with partners and figure out like how do we, again, like just make sure people can thrive and live in a space that is violence free and safe. So I think I'll stop rambling about my soapbox of like it's a integrated approach.
Well, we have time for one more question if you do want to ask a question.
Yeah, I really would. I wanted to ask folks on the line in Colorado, especially like what are some efforts that you've been excited about in your state around like making sure the young people are safe, especially whether or not they involve community partners or not, because like I said, I thought that this is a great approach. As a person who does a lot of community engaged work, I was so excited that this was happening and that we were trying to think about how to work use our community partners as assets, rather than rely so heavily on our police department. So I'd love to hear from others if you've had approaches like this, whether you use it doesn't necessarily have to be curfew enforcement, but really thinking about community engaged approaches to reducing violence. So I just want to know what's exciting, what's happening in Colorado. Nothing's happening in Colorado. I don't believe it.
Some shy folks. I'm tempted to like call on someone. I wish I knew. Yeah, wish I knew a little more about it, but I do know there's some precincts who are innovating with mental health response teams, and I don't want to say too much for fear of being wrong about the details, but I know that's happening across the country, and there are some areas of Colorado where that's happening.
Yep, it's happened here too. So even training in our EMS staff, like, dude, like not everybody's trying to hurt you. They just may need a different kind of support. So helping you to be able to de-escalate that isn't really important. And so I just started to share again, if there are questions that you have about this work, or I'm a good thought partner. I always say I have more questions than answers. So put our information here, our emails. You can find us on the web and even follow us on Instagram for some more updates about this work and the work that we do around adolescent health. So thank you.
Thank you so much. And with that, we'll officially conclude the webinar, and we can stop the recording.